My name is Desiree Santoyo. It is April 26, 2024, and today I'm going to be giving a presentation about Gaucher disease. As I previously mentioned, we are going to talk about Gaucher disease. What is Gaucher disease? Gaucher disease causes a mutation on the GBA gene that causes a decreased production and activity of glucocerebrosidase, an enzyme that breaks down glucocerebroside. This causes the lysosomes within the macrophages of the tissues to accumulate large amounts of glucocerebroside. As a result, these fatty macrophages become Gaucher cells that affect the liver, spleen, and bone marrow. The Gaucher cells also produce lysosomal enzymes and inflammatory signals that elicit an immune response and causes high production of scar tissue. When Gaucher disease affects the bone marrow, it can lead to bone marrow fibrosis, causing decreased production of red blood cells. In turn, this causes the individual to suffer from anemia and fatigue. It also can lead to bone infarctions due to low blood flow to the areas of the bone, leading to stature deformities, avascular necrosis, and osteoporosis. Lastly, it can cause the liver and spleen to become enlarged. This can cause platelets to become trapped in the spleen, causing low platelets throughout the circulatory system, known as thrombocytopenia. This can lead to easy bruising and excessive bleeding. It can also affect the central nervous system in some types of Gaucher disease. I found this helpful diagram on a website that promotes the education of Gaucher disease. Here it shows a macrophage swallowing waste material, forming a lysosome around the waste material. A normal macrophage with enzymes will degrade the waste material. However, in Gaucher disease, the lack of enzyme causes a majority of the waste to remain within the lysosome, causing Gaucher cells. There are three main types of Gaucher disease. Type 1 is the most common form in Western civilization. A lot of the symptoms are what we previously discussed in the last slide: high production of scar tissue, bone marrow fibrosis, anemia, fatigue, bone marrow infarctions, avascular necrosis, osteoporosis, enlargement of liver and spleen. Type 2 heavily affects the central nervous system and is unfortunately fatal by 2 years of age. Type 3 has a more positive outlook. It has a higher survival rate into adulthood than Type 2, and the onset is much later. It has all the symptoms of Type 1 as well. However, neurological issues are also involved. Next, we could discuss the treatment for Gaucher disease. Historically, splenectomies were done in cases of Gaucher disease. However, recent studies have shown that partial splenectomies have shown to be more beneficial compared to full splenectomies. Full splenectomies have been shown to lead to compromising the immune system, while partial splenectomies have shown that they keep splenic activity necessary for antibodies while also slowing down the development of liver and bone marrow disease. Treatment varies on the condition type and severity, but involves enzyme replacement therapy or substrate reduction therapy. Enzyme replacement therapy is done intravenously and uses a synthetic form of glucocerebrosidase. However, it is only suitable for treating type 1 due to the blood-brain barrier preventing the enzyme from crossing over to the central nervous system. Substrate reduction therapy is an orally administered treatment and contains a molecule that blocks the enzymes that synthesize glucocerebroside. This molecule is small enough to cross the blood-brain barrier and is a more suitable treatment for type 3 Gaucher disease. It is extremely important to note that although these treatments help the side effects of Gaucher disease, they do not cure Gaucher disease. There are currently no cures for this disease. How is Gaucher disease passed down to generations? It is a heritable autosomal recessive disease. This means that a copy of the mutated gene must be passed down from both parents. It is not sex-linked. Currently, there are no known connections to cell cycle checkpoint failures in Gaucher disease. The risk of Gaucher disease is not related to epigenetic factors. However, side effects can be supported. Healthy gut foods can minimize inflammation. Supplementing calcium and iron can aid in supporting healthy blood and bones, and physical activity and mindfulness can reduce stress and inflammation. As we briefly touched on, the GBA1 gene is affected in Gaucher disease and is typically responsible for encoding the lysosomal membrane protein. The specific mutation can be found 12 kilobases downstream on chromosome 1. Here's a picture that I took from the internet that shows chromosome 1, a karyotype of chromosome 1. Genetic testing is routinely used to see if an individual is a carrier or affected. To test for Gaucher disease specifically, it is done genetically by identifying biallelic pathogenic variants in GBA1. There is not just one specific mutation that leads to Gaucher disease. In fact, there are a variety of different types, and ironically, there is no correlation between the mutation type and the symptoms experienced. However, environmental factors and individual's genetic makeup has shown to influence how Gaucher disease is expressed. Other than genetic testing, there are other testings done for Gaucher disease. Gaucher disease is tested by the enzymatic activity levels of glucocerebrosidase within leukocytes or mononuclear or clustered fibroblasts. Individuals who have Gaucher disease have 10 to 15% of the normal glucocerebrosidase enzymatic activity. This can be diagnosed through specific blood work panel or bone marrow aspiration. Gaucher disease is an extremely rare disease, so it is not likely to be done in a routine checkup. This is why it is usually diagnosed years after onset of symptoms. Unfortunately, currently, there are no preventative options for Gaucher disease. However, early diagnosis and treatment can serve as a preventative for the long-lasting side effects such as damage to bones, organs, and neurological impairment. There are only two main utilized approved therapies for Gaucher disease, which we've already discussed: ERT, enzyme replacement therapy, and SRT, substrate reduction therapy. There are currently 3 different ERTs being practiced, with no significant difference between them. ERT is done intravenously and has few adverse effects and closely mimics the enzymatic activity of glucocerebrosidase. However, the downplay is that ERT, as mentioned previously, is not effective for Gaucher disease type 2. Unlike ERT, SRT does not improve or mimic glucocerebrosidase. Instead, it decreases the glucocerebrosidase production. SRTs are more affordable than ERTs, however, many individuals stick with ERT due to the negative side effects of the medication. There are also pharmacological chaperones in clinical trials currently that can cross the blood-brain barrier that are aimed to treat the neuronopathic symptoms of Gaucher disease type 2 and type 3. Overall, there has been a professional consensus of the future management of Gaucher disease within physicians that are currently or have experience treating the disease. Their goal is to give individuals the highest quality of life through restoring normal values, preventing complications that come with the disease, and eliminate anemia, bone disease, and organ complications. There are several outgoing studies taking place to improve the treatment and understanding of Gaucher disease. Some of the ongoing studies include the connection between Parkinson and Gaucher disease due to the fact that they both affect GBA1 gene. They are also doing research on in utero treatment for Gaucher disease types 2 and 3, and utilization of AI for Gaucher disease. Lastly, before wrapping things up, I wanted to share this diagram that I found from an academic journal that discusses Gaucher disease and keys into the lysosomal dysfunction itself. It does a beautiful job illustrating the comparison of lysosomes within the neurons of the central nervous system of individuals with Gaucher disease and those without it. Remember, this would only be type 2 and type 3 Gaucher diseased individuals, because only type 2 and type 3 affect the central nervous system. But here, we can see the big difference in congestion between a normal neuron and a Gaucher disease neuron. This is simply due just to the lysosome number being increased and the lysosome size being increased, because those waste materials cannot be digested. We could see over here even further that it increases the pH level due to the decreased lysosomal enzymatic activity. And we could even see that it causes an accumulation of secondary substrates, causing more congestion and more chaos throughout the neuron itself, making it extremely evident on why it's causing a lot of issues neurologically. Here are the many resources that I used to help me out with this presentation.